Welcome to my YouTube channel. In the following clip I will talk to you about the difference between diabetes and high blood sugar. Stay with me in this clip and you will understand exactly what it is about. Pleasant viewing. Key difference. High blood sugar is a condition that can sometimes affect some people. Blood sugar concentration or blood glucose level is the amount of glucose, sugar, that is present in the blood. If your blood sugar level is often outside the normal range, it may be an indicator of a medical condition such as diabetes. Diabetes is a type of disease that affects people with high blood sugar. High blood sugar is a condition that can sometimes affect some people. Blood sugar concentration or blood glucose level is the amount of glucose, sugar, that is present in the blood. Glucose is transported from the intestines or liver to the cells of the body via the bloodstream. Here, a hormone makes glucose available for cellular uptake. The hormone is called insulin, and it is produced primarily in the pancreas. The reason for high blood sugar levels is that there is either not enough insulin in the body, or the cells are not reacting as expected to the insulin. Both cases result in cells that do not absorb glucose, therefore increasing the level of glucose in the blood. According to Wikipedia, the recommended level of normal blood sugar level in humans is about 5.5 mm, 5.5 ml or 100 mg, dl, i.e., milligrams, deciliter. However, the level fluctuates throughout the day, depending on the time and amount of food eaten. Glucose levels are usually lowest in the morning, before the first meal of the day, and rise an hour or two after meals by a few millimolars. Wikipedia states that the normal mealtime blood glucose level, that is, before the first meal of the day, for diabetics, should be between 70 and 100 mg per deciliter, mg, dl, while the blood sugar level for those non-diabetic and non-fasting should be below 125 mg, dl. It is the body's job to naturally maintain glucose levels as part of metabolic homeostasis. However, sometimes the body may not be able to tightly regulate blood glucose levels. If your blood sugar level is often outside the normal range, it may be an indicator of a medical condition such as diabetes. Diabetes is a type of disease that affects people with high blood sugar. There can be two main reasons for diabetes. Either the pancreas does not produce enough insulin to counteract the amount of glucose in the blood, or the cells do not respond to the insulin produced. High blood sugar levels correspond to the classic symptoms of frequent urination, increased thirst and increased hunger. There are three main types of diabetes. Type 1 diabetes. This refers to the body's failure to produce insulin. The person needs to inject insulin, or wear an insulin pump, also known as juvenile diabetes. Type 2 diabetes. This results from insulin resistance, where cells fail to use insulin properly or are resistant to insulin, also known as adult-onset diabetes. Gestational diabetes. This happens when pregnant women without a previous diagnosis of diabetes develop high blood sugar levels. May precede the development of type 2 DM. Some other forms of diabetes include congenital diabetes, which is due to genetic defect in insulin secretion, cystic fibrosis, high-dose glucocorticoid-induced steroid diabetes, and several forms of monogenic diabetes. According to the American Diabetes Association, the target blood glucose range for diabetics should be 70-130 mg, dl, before meals and less than 180 mg, dl after meals. Alexandru, thanks for viewing. If you liked the video, don't forget